surface, we inspect contours, we inspect for movement. After inspection, we're going to move to auscultation. Now, in auscultation, we're going to do general auscultation of the abdomen, okay? Then we're going to auscultate for rubs, both hepatic and splenic, and then we'll turn over to the bell for the last part of auscultation and auscultate for bruits. Okay, so we're going to start diaphragm, and we're going to auscultate, general auscultation. What are we listening for, general auscultation? What's that? Not bruits yet. We will in a little bit. What was it? Peristalsis, right? We're listening for the sounds of peristalsis, and they're described as clicks and gurgles. So in a minute when you listen, you're going to hear clicking and gurgling. That's the smooth muscle pushing bolus through. Does that make sense? Now, Dr. DMAC, she's able to listen and tell what people had for lunch. So if you're really good, you'll be able to do that. Now,
I did guess.
Yeah.
Correctly.
It's true.
I mean, I told the person what they had. I didn't guess.
So, all right, so we're going to use diaphragm, right? We're going to draw a crosshair in our mind right through the umbilicus. So we've got our 4 quadrants. We need to listen in each quadrant. Now in practice, you're going to listen as long as you need to make the correct determination. For the practical, I want to see you listen to at least 2 spots in each quadrant, a couple seconds a spot, okay? So we're listening to normal bowel sounds. How are they described? Clicks and gurgles. The normal rate is 5 to 34 clicks and gurgles per minute. I will let you on the practical tell me 5 to 35. I mean, it's just a lot easier to remember, right? So 5 to 34 clicks and gurgles per minute is normal. If you do not hear any, that's not good, right? So if you hear no bowel sounds, before you say that, you need to listen for at least 2 minutes, okay? What kind of things might cause no bowel sounds, cause you to lose? What's that? Late obstruction, good. What else? Peritonitis is common, okay? Have no bowel sounds. So, serious things cause no bowel sounds. Now, there's other signs and symptoms, those peritoneal symptoms we talked about, constipation, those type of things. So there's other signs and symptoms, but no, if there's no bowel sounds, it's serious. And how long do you have to listen before you say that?
2 minutes.
2 minutes. All right, so when we perform this, we're going to listen in a clockwise manner, area of pain last. So if he has pain here in the right lower quadrant, I'll start right upper, left lower, and end in the area of pain, moving in a clockwise direction. Does that make sense? So when we listen, oh, really good clicks and gurgles. Someone's in for a treat here.
You know what that means.
All right, how long would you listen if there were none? At least 2 minutes, right? Clockwise, area of pain last. Make sense? Now, if they're hyperactive, the same things we said could increase peristalsis: early obstruction, diarrhea, most common causes. But if there's none, that's serious. You got to make sure, okay? Everyone understand how we're going to do this? All right, go ahead and get in pairs. Make sure you can hear these bowel sounds.